little far.
Yes, a little bit. But it's okay. Yes, a little bit.
พรุ่งนี้กูใส่เสื้อที่ซื้อมาจากอินเดียดีกว่าลืมอุตส่าห์ซื้อมาทั้ง4 ชุดแต่กินอยู่นะจ๊ะลืมไปเลย
Yes, can you just introduce yourself a bit in the beginning and then explain what we do here?
Okay.
Yes.
Hi, my name is Kung Termwanit. I'm a clinic operation manager at IHRI Tangerine Clinic, which is operated by the Institute of HIV Research and Innovation. Yeah, at IHRI Tangerine Clinic, we offer sexual health and other comprehensive health packages for all gender. Tangerine Clinic itself is actually trans-specific and is led by the transgender community in terms of designing the service and delivering the service.
Okay, so what services do you provide and to whom? Who are the clients and what services are you providing?
Who are our clients? Our clients range. It could be everyone, but our main target are men who have sex with men and transgender women, especially younger generation now who as we know that the new infection is at younger population, so we would like to focus more on that group. And our service range from screening, testing, prevention and treatment of sexual transmitted infections and HIV. For Tangerine itself, it has gender affirming care as well.
Okay, so how does this model of key population-led health services function on the front line? How do you function on the ground? Because this is led by key populations, is it?
Well, yes, but not fully. IHRI, our institute itself, actually, together with the community-led partners, design that model for them to deliver it. But Tangerine itself, also led by the key population, which are transgender population. However, because we have the doctors here, so many of community-led health services clinic, they don't even have the doctor, so they can deliver the service by themselves. Yeah,
Okay.
so that's just a tiny difference.
Mm-hmm. And what is the number of clients you are catering to?
So Tangerine, since they opened from 2017, we have had almost 8,000 transgender clients, including transgender men, receiving the service. For IHRI itself, is almost 20,000 clients since we opened in 2020.
Okay.
Yeah.
Great. Any problems you have faced on the ground in doing this extraordinary work? Because we always quote from Thailand's example, how they have involved the community to deliver services. But any problems which you have faced over the years? Any success stories, any failures you came across?
I think the challenges that we have faced here at many levels, firstly, like many other countries in Asia, sexual health is still taboo. It's still stigmatized by the general population. So in walking into the clinic could be a problem for others, our clients especially. That means sometimes that means they have to reveal themselves, their identity, and they might not be comfortable to do that. And this is why we decide the clinic to be as neutral as possible and not label anything specifically for anyone, because we actually welcome everyone, and we hope to have everyone be able to access the service. However, health-seeking behavior in Thailand is still not very high. Some don't think they're at risk, And this needs a lot of campaign, like demand generation campaign, in order to invite more clients to receive their service. It doesn't need to be at our clinic. It could be anywhere, but we would like everyone to be able to test and treat early. Yeah. However, at national level, it's getting better, and then it kind of set back. So in the past 3 or 4 years, we have received such we one of the a few countries in the world that we provide free prep to everyone, and HIV self-test for everyone for free. And HIV testing is also free in this country. However, for community-led health services, it used to be they used to be able to prescribe PrEP from their clinic, because that's what a lot of clients prefer to go there, because it's more of their community. However, there was a restriction in the past 2 years that they cannot store the medicine anymore, and that bring us back to like zero, where you still have to go to the hospital to receive the medicines. Yeah, so that block us a little bit, but as a alliance for community-led health services, we trying to find the middle way and advocate for the widespread PrEP in the nation.
Yes.
Yeah. And recently, as everyone knows, the biggest challenge is the funding cut. Yeah, so Tangerine itself used to be funded by the U.S. government. So that means the trans client can come here and receive hormone therapy for free. Not anymore. For us, hormone therapy or gender affirming care is actually the entry point to bring trans community for other sexual health, and it has proven that successful. It's a successful model and adopted by many other countries. However, by not having funding to support that, we have lost many trans clients in the past few months since that regulation was issued.
So, are there any plans? How do you overcome this funding problem? Because what about the government's role in it? Will the government increase its domestic funding? Or
That's a very good question. Yeah, exactly. Some would say that we should not rely on international aid too much, because it's not their responsibility, which is right in a way. And this is why now we are advocate for the National Health Security Office to. They actually did it last year, luckily, to endorse gender affirming care into the universal health coverage. However, there's some criteria that it depends on the doctor whether they should receive that service or not. So not all doctors agree with that model, right? So there's still a gap. Yeah, but so we are still trying to advocate for better, because we think that one package doesn't fit all. Everyone has their own limitation or in lives, yeah, and they're all different, and we should have something cater to all those differences.
but I still feel that Thailand is really a role model for so many other countries in Asia Pacific, at least, where you all are doing such good service.
Yes, I think Thailand is in a better place compared to other countries, but our progress has been what you call stable. It's not going up for in the past decade, actually. So we would love to see another leaping development in the country to be, basically for the benefit of the Thai people as well.
Why is it not going up? Any special reasons for that you can think of?
I think on one hand, it could be that we think we are good already.
Okay.
So we don't need to do more. Like at some point we think HIV is an old issue. Nobody is aware of HIV anymore, and they are more aware of other health issues instead. So I think it could be the same reason, or it could be that the the priority of HIV is not so high in the country anymore. Yeah, due to the new infection is not increasing sharply like before. Yeah, so I think it could delay or it could halt the progress a little bit. Yeah,
What about PrEP uptake in
in Thailand. No, not quite sure about that. But I could tell that in our clinic, the PrEP uptake is about 27%. Yeah. Among men who have sex with men are higher than transgender women. Yeah. And that because PrEP is free as well, I think. So that increased the PrEP uptake a lot. However, what we are trying to advocate now is for the same thing to apply to PrEP online. Yeah, so if you receive HIV self-testing to use at home, you can get PrEP for free online as well. At this point, we cannot do that yet. The government doesn't allow, but we hope that will be one thing we can accomplish in the near future.
but self-testing is happening in Thailand.
It's happening. Well, that's another thing too. Self-testing has been legalized since 2019, but most Thai don't even know that. Yeah, and actually 2 years ago, the National Health Security Office has endorsed it to universal health coverage, and nobody knows that. So that it needs a lot of all parties to help and do a campaign and raise awareness of people to know that this exists and the benefit exists, and you have the right to get that for free.
So perhaps you need to have more such outlets in other cities of Thailand.
Yeah, that's also a gap. We are hoping that will happen soon. I know that the government starting to have the vending machines at some hotspots. We have clinics, like community-led health clinics in the main city around the countries. Yeah, so we think that will help at some point, but the government, I think, it has to do a better job at expanding it, because at this point they expanded at the hospital, so you have to go to the hospital to buy it, which doesn't address the gap of people not coming to the facility to receive the service. Yeah, so I think to be available online anywhere is probably better.
Is better. And when do you think that is going to happen?
I think it will. There's nothing prohibited to happen. It's just not happening yet. I know that there are a lot online already, but it's not the FDA approved one. I know they try to put it at the pharmacies. That happens, but it's behind the counter. So you have to, for the clients, you have to overcome your own the society stigma and ask them if they have it. So yeah, instead of if they can grab it like COVID test,
Right.
we would like to normalize that.
Yes,
Yeah,
yes. That is very important. To normalize is very important. Yes.
yeah.
But you are doing great work.
Thank you very much.
Thank you for that. Thank you.
Would you like to also interview some of
Yes.
the trans
Yes.
staff?
Yes, please.